All right, friends, we are back at PFRANKMD, and today we are doing something new on Jeanette here. And we're going to perform some biostim treatments on the legs. Now, cellulite is one of the most discerning problems that people come to me for body sculpting. I could adjust fat, people could lose weight, they could exercise, but cellulite is really resistant to diet and exercise, even for people who are built as wonderfully as she is. It can be very, very frustrating. Part of it's genetic, part of it is just life. But one of the amazing treatments that we use is using various formulas of fillers. Yes, fillers, but we're not using them to create volume. We're using them to smooth and biostimulate collagen and smoothen tissue. So we can actually fill divots, tighten skin all at the same time. Now, sometimes we do this in combination with body sculpting, liposculpting, removal of fat, but this is really an icing on the cake. It feels like you're getting filler, but you're really not making your legs or your butt bigger. We can do that with other treatments, but for this, it's really about smoothing. Most people do a series of 1 to 3 treatments. She's probably gonna get away with 1. The results do last a long time, whereas if you use certain fillers in the face, it may last 6 months to a year. But usually once you get people looking good in the legs, they probably don't need a touch-up till next summer, unless of course they need several treatments to get to their end result. There are several different fillers you can use. I like for superficial cellulite, hyperdilute radius. You can use Sculptra. These are the biostimulatory fillers. And as with all things at PFRANKMD, we get the best results by combining several small things. So we will often do skin tightening with devices like M-Tone, Axillus, radiofrequency, ultrasound, and really the art is in combining all this to get a great result. So she's sitting with some topical anesthesia right now. She thinks she's much worse than she really is, like most of my patients, but I really think one treatment is going to be great. In terms of downtime, there could be a week of a little bit of swelling, a little bit of bruising. I tell people to take off the aerobic exercise for 1 or 2 days. Sometimes I give an anti-inflammatory, and I really tell people you don't want to be on the beach in St. Bart's for 2 weeks because you could have a prolonged bruise. Just the nature of healing, it takes a little longer to heal on the legs than it does on the face. And I know you're going to want to get back to exercise as soon as possible.
Yes.
I usually evaluate the patients 1 month after, 4 to 6 weeks. That gives time for the biostimulatory component, and we can see what we have to see if we need more treatments of this or of any other modality. So stay tuned. Okay guys, we're going to do a little biostim treatment. I'm using some hyperdilute radius. We're using several different gauge needles here to work at different layers of the skin. There really is an art to doing this, just like when you're doing injectables in the face. She is very mild. She thinks she's worse, but I'm going to first work on the side area. She has some deeper indentations, and then I'm going to work to smoothen and tighten. So she'll feel the first few pokes. Here we go. First deep opening. See, you get a few little butt jerks, totally normal.
What is that, the Novocaine?
No, what you're feeling is the needle going in.
Oh, really?
Yeah.
Why do I only feel the first few pokes? Is this your magic trick?
This is my magic trick. You do see some result right away. This is a treatment generally for people who are in very good shape that are super frustrated with not getting what they want to achieve ultimately. Because again, it's just very difficult to exercise cellulite away. It's just very frustrating for people. And this is a cement that we can combine with other things that will give a nice smooth result.
Do you see it yet?
Yeah, of course you see some. Color, you gonna give me a 28?
Sure.
Next. Now I'm going to work a little bit more superficially here. Feel me behind your leg. Great. This area is just about done. Okay. It's the formula of the filler, the instrumentation, and then the judgment of the injector. That's really it. But
I have to tell you, this is my and like when we do a live, I'm excited to talk about stuff, but like this is my most insecure area is the front. Because as a woman, you just feel like, oh, it's normal to have cellulite on the back of your thighs and on your bum, but on your front, it's like, it's a big insecurity.
yeah,
It's also new.
it's frustrating.
It's called the age, little bitch.
In all honesty, Jeanette, you're going to get some results from what I'm doing, but for the front of the thighs, you may just do a series of what's called M-tone treatments, which tightens up the skin because you don't have that many divots here. So I'll discuss that with you after.
Okay.
Because you have good elasticity in your skin. All right, she did not pass out on me, ladies and gentlemen. This is a procedure that's performed standing up biostim injections. She's a little bit bruised here. This is normal, it can last a few days. I always tell people up to 2 weeks, just in case. Better to say the worst, prepare for the worst, and hope for the best. She'll see it, when the bruising goes away, she will see a difference. There is some immediate effect, but again, we're gonna get the biostimulatory collagen building effect over the next few weeks. I'll reevaluate her at 1 month. We can consider doing nothing. We consider doing a little bit more biostim, or we can consider other modalities to tighten the skin, M-tone, Sillis, things of that nature. You had a question for me?
Well, no, I mean, it's incredible to me because the most insecure part of my body has been the front of my thighs. You typically hear about girls with cellulite in the back, which is normal, but then when you have something that you consider to be unusual, it just makes you insecure. And immediately, just looking down at it, I saw a smoothness.
A smoother, yeah. Well, I always tell people, you are special, but you are not uncommon, because everyone thinks that they're the only person that has the condition.
Yeah.
It's like women with hair loss. Like until you are a woman with hair loss, you think only guys lose their hair.
Yeah.
And it's similar with cellulite. It's very frustrating. We only assimilate cellulite with the booty and behind the leg, but you can really have it anywhere. People have cellulite on the inner side of the arm, their décolletage. Cellulite is cellulite. And there are several causes of cellulite: irregular fat, loss of collagen, irregular lymphatic drainage, and this is one of the many treatments that will help it out. We'll decide on skin tightening, which skin tightening works best on the front of the thigh.
Great.
So we're going to talk about those things next time.
Okay, so as you know, I went to see my friend, Dr. Frank, who did my incredible threads. He said they last about a year. While I was there, I was also discussing with him something that just literally I can't get rid of is my cellulite, particularly on the backs of my thighs. So it was amazing. He injected my dimples, not too many of them, with his special sauce, and immediately I had the results of smoother skin, less dimpling. It doesn't make it go away entirely, but for the big boys, it's such a remarkable difference. And if it's something that you struggle with and feel insecure about, it's definitely something I would recommend.